live.
Just tell me when the first person's on.
Okay.
Okay,
So we're live
I'm just
now.
gonna get here. I'm not like Henry, which has like, 500,000
I know,
people
right?
joining. You know, he had surgery with my husband, and when he did that, like almost 500,000 people on
Oh,
Facebook
we got the
watching.
first one.
I'm not surprised. He's so funny.
We got two.
Hi everyone, Dr. Sarah here. We are going to be treating my patient's horizontal neck lines. She feels like she's got these deep lines across her neck, and we're going to be treating it with what's called calcium hydroxyapatite, and it is a filler, but it is also a stimulant that is going to stimulate new collagen synthesis. And so we're going to be injecting that into her lines to try to help rejuvenate her neck. So right now what I'm doing is I have local anesthetic for the cannula, and I'm going to be cleaning her neck with chlorhexidine since she's still icing it. Desterilizing my area.
Sorry.
And so you can see the two horizontal. I have her neck extended so you don't see it like too deep, but they're right here. And so what I'm going to be doing is injecting a little bit of numbing at the side. Okay. Is that okay?
Mm-hmm.
And then I see your big vein here, so I'm going to avoid that. So that's just for the entry site for the cannula. Let me come back over here. I'm going to do it right over here. And then one here. I don't know if you can see me on the handle. Okay. And then I'm going to just do two in the center, okay? Pinch, 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 pinch. Okay, and one right here. Pinch, 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 pinch. Okay, perfect. Okay, so that's just numbing that. And then I'm going to put this down. Don't fall over, Gracie. Okay, so this is for the cannula. And then I'm going to just change the needle out to this one. Okay. So first I'm just going to poke a little hole. You didn't touch anything,
No.
Let me just clean it again, just in case. Okay. So do you feel that? Do you feel that?
No, just very, very slightly.
Like a pinch?
But not even a pinch.
Let's see, I'm just going to see where I injected you. It's blending in so nicely. Do you feel that?
I felt just a little pinch, but that's
Okay,
it.
just in case. Hold on.
I mean, I feel a little something, but it's not painful at all.
No.
No.
So let me just make sure. Okay. That we can see. So you're going to be injecting hyperdilute Radiesse into these areas. Is that Aphrodite? Oh no, that was one of the patients.
If you're interested in a fat transfer to the lips, our recommendation is to visit our website for a consultation because we can't really give a starting price without knowing exactly where we're going to get the fat from.
Hold on, let me just kind of clean that. Lucy, can you just lift it
Yeah.
up a little?
What is the little vibrating tool you use?
It's just supposed to distract you. But
Yeah, it actually works. Like,
Does
it's,
it?
yeah, I've never had it used before, but
Okay. Your skin.
I'm going to come around
Girl.
to the other side. Get a little better view.
You see, Lucy?
Mm-hmm.
So the cannula is a non-sharp, very blunt needle, and so it's hard sometimes to get into that teeny tiny hole that I created, but it's there, so I just need to kind of be a little teensy bit aggressive. Sorry, my dear. Sometimes it slides easily, and sometimes no. And you're one of those no ones.
Of course.
Okay, one more time. One more time. Let's see it in there. Then it comes out. There we go. Okay. So we're just going to slide over here. Just turn your head a little bit so you can kind of see the cannula coming in and sliding over here. Can you guys see that? Sorry.
All right, we had a couple new people join us. So today we are filling in tech neck lines with Radiesse filler.
And Radiesse is a biological stimulating filler that's going to stimulate her body to produce new collagen. You know what this thing is? I'm going to do this.
It may look painful,
Lift
but
your head up for a second.
before we started putting the needle in, we did nerve blocks. So she can't feel anything. She's numb. And this little tool here, we call it a distractor.
It works.
Yeah, exactly. We place it on the skin and it vibrates, and it kind of helps prevent you from feeling the other pain. You just feel the vibration.
Perfect.
Now, will the results be instant, or will they take a couple of days to...
So they will be instant, but as far as the collagen synthesis for itself, that takes about 6 weeks to really see a big difference. Okay, so that was that. Let me just kind of go a little lower. So you can see she's got these lines. Here's one line here, and here's another line across here. So I'm going to be injecting into these two deeper lines. So I'm going to use half the syringe, or half the amount over here, and then the other half a little bit higher up.
Sydney wants to know, do you laser stretch marks off thighs?
Yes, we could do laser, we could do microneedling, or radio frequency. They all can help, but yes, we do. So here, so you see the cannula coming over. See, it's like a long, it doesn't hurt. And I just kind of slides right through the tissue. And then I'm going to lay down the Radiesse in a very thin ribbon. Is that okay? You're doing okay?
Yeah.
Okay. And you know what? I'm going to go this way too, because we have a teeny tiny bit of a line going in the opposite direction. And so we are just injecting the lines. And maybe we could talk also about the, well, I was going to say about the rhino, but since we're not doing it.
We lied.
No.
Yeah.
It gets super slippery. Okay. Any other questions, Gracie?
Not yet. Oh, just got one. Do you also do laser upper lip removal, and how long does each process take?
Upper lip removal.
Do you think maybe reversal? Like, did you have filler in your upper lip and you'd like to reverse it?
Let me do this out here.
If you're talking about reversing lip filler, that is typically just one session, right, Dr. Sarah? Or do people do multiple sessions?
It can be multiple. It depends on the filler that was used. Just make it kind of straight for you.
Okay.
Yeah, just it depends on the filler used, because certain fillers Sorry, I'm gonna make a hole. Certain fillers that are highly cross-linked, like in the Juvederm line, it's going to be the ones that start with a V, like Velour, Volbella, Voluma. Those are highly cross-linked and have a lot more connections. So sometimes require more than one reversal. Depends how much filler you have in the lips, to be quite honest.
Oh, she says laser hair removal, like hair on the upper lip.
Oh,
Got
wow.
it.
Hair removal takes about 6 sessions. But yeah, we do that here. Depends, depends how thick the hair is. So yeah, so this is filling nicely right in the groove.
Mm-hmm.
You can kind of see
You can see the
cannula coming over here right in the groove and filling the area right here. See this kind of sliding over. You're doing great.
So what's the recovery? Like how sore is it going to have any soreness to it? I'm sure.
A little bit, yeah, from the pokes and things
Okay,
like that.
but
Once
other
all the
than that-
numbing wears off, you're going to feel a little bit of soreness. You can massage the neck
Mm-hmm.
and massage out any kind of like lumps or bumps. I'll do that as well.
Okay. Any bruising, you think?
I think it's going to be minimal because I used the cannula versus a needle, which would have given me more. You may have a little bit of bruising at the entry sites as well.
I can cover that.
So I'm just going to kind of fan a little bit everywhere to kind of give her a better overall result.
Oh, Sydney heard about us from Hank and Henry.
And that's how this patient's here.
He's going to text me and be like, oh my God, what are you doing?
Have you've been on the lives you said with him?
Yeah, well, I mean, I do his,
All the social media.
yeah, he has a thing called the Beauty Talk series, and he has like different educators that come on and do like more makeup tutorials and use his products.
So have you guys seen the beauty talk with Henry, Hank and Henry? Well, she is in charge of that.
There's 4 of us, so there's.
No, you're in charge.
I'm in charge. Yeah, I'm in charge, Henry. You're listening. Yeah. I do mine on Sundays at 5 o'clock. So if you guys want to watch them,
We love Henry here. He's so sweet.
Yeah, he's a fun
And
patient to
Bob, I'm
have.
sure you know everybody, the whole
oh
crew.
yeah, Gary, he does my hair when I'm here.
Where do you said you live in Mississippi?
Mhm.
Where in Mississippi?
South Mississippi, close to about an hour and a half from the Gulf Coast.
I have a friend who lives in Gulfport. It's beautiful.
Tornado territory.
Mm.
Yeah.
Is that where, did you guys have like bad tornadoes like last year? Is that where it kind of ripped through?
Probably a couple of months ago, and then we just had those 2 that came and they actually moved and went through Louisiana and Texas, so we didn't get much of it. But I lived through Katrina and all of the
And bend your neck down a little bit. Let me just kind of see. I need a little bit more of this one.
We do have skincare products. We carry a line called YovinoMD, and it's full of medical grade skincare products.
And so medical grade, for people that don't know the difference, they are skincare products that have higher concentrations of all the active ingredients. They're clinically proven to give you results. And they're just way superior to anything that you can buy over the counter. So I think ours are pretty affordable, like in that batch.
Absolutely.
You're not going to pay like, $500 for one product. So they're pretty affordable, anywhere from $120 on down. So
Sydney asks, how old does the patient have to be to go to you guys?
well, 18 preferably, but if you're younger than 18 and have an issue and you come in with a parent, then we will see you and see if you're a good candidate for whatever you are interested in.
Here, I'll put the link to our skincare website in this live comments. Let's see, YovinoMD skin.
Okay, so I'm going to come on to the other side.
It's so numb. I feel like I'm in the dentist almost. It's like working its way up. Do I need to?
Yeah, lift up and I'm going to slide this over. Okay, perfect. Yeah.
Okay, so I pinned our skincare website. If you're interested, go check it out.
You've got really nice, tough skin, girl.
No, that's a good thing or a bad thing.
And you can already see from where we were starting, you can already start to see the difference.
Can you do one?
Well, happy late birthday, Sydney. Okay, I'm gonna put this.
Excuse me.
Okay.
She's got one hand.
Yeah.
So we are injecting her what we call tech necklines, and with what's called calcium hydroxyapatite. It is a filler and biological stimulant, and we are injecting these lines in her neck with this to help stimulate her collagen synthesis, which will take about 6 weeks after this to really stimulate. And we're doing that right now. That's what we're doing here. We also have a cream called Tech Neck Cream that's specifically formulated for the treatment of these lines, and that can be put on twice a day to help with them as well. So we're just going to be injecting the lines from both ends. It takes about 6 weeks for the collagen to really remodel and reform and increase in production. So we're doing that. So, Sydney still watching?
I think so.
So Sydney, she had seen the Live with Henry for his liquid rhino and came in wanting to know if she was a good candidate, but I thought not, just because she has a very straight bridge, and her problem is these two, she broke her nose, and there's these 2 points here, and so anytime to try to softening of that, I think would just add width to her nose, and she wouldn't be happy. Kind of like a reindeer, how it has a wide nose, but it doesn't project out. It would kind of give her that kind of a look, and she wouldn't. Most women don't like that look. So, okay, let me come over here. This way. We have to focus it down one last time. This just kind of clears the area and allows me to slide on over. Like that. And here's the cannula. The good thing about the cannula is it just pushes the tissue out of the way and allows whatever you're injecting to slide through the tissue nicely.
Sydney wants to know, does the laser hurt?
Laser hair removal?
Mm-hmm.
It feels like a rubber band. Feels like a rubber band kind of snapping against your skin. But other than that, no. It's tolerable. And you can't have you have to have avoided the sun for at least 2 weeks prior. And, we can always do a test dose in a certain location to see how you respond. But, okay. There we go.
Well, you don't have to be scared of any procedures when you're here, because you're always in good hands.
That's right. So here we are, we're injecting the lines and filling them up with this dilute filler.
Yeah, one fun fact about Dr. Sarah is that she also specializes in pain management. So that means that she has all different kinds of methods to make the procedures the least painful that they can possibly be.
That's right. You can stand on the side if it helps.
Well, it's kind of a...
Can they still see?
Yeah. She said that she's Italian and Indian, so she has dark hair and skin.
Okay. Usually laser hair removal is better on people who have darker hair and coarser hair versus someone who's blonde, because it has to be able to sense the pigment in the hair shaft. Okay, we're almost done here. Just kind of giving her a little bit of collagen building all over. You okay? Does it? Is it your neck super numb now?
It's pretty numb. I can only feel just like the little like pushing and tugging, but it doesn't hurt.
Okay. So this is mixed with local anesthetic to help with the discomfort. So we're almost done here. There's just one more little spot I kind of want to get to.
And for anyone who's been with us since the beginning, you can see what a difference.
I'm so excited.
And for the big reveal.
So yeah, so just bring it next to it. I'm just gonna take it this side.
Oh yeah, it's really numb.
How long does each lip hair removal take? Or how long would each treatment be?
15 minutes, less than that. 15 minutes or less. So I'm just massaging it in and just kind of spreading the product around a little bit better. You can, it's making kind of a soapy. This is like a surgical scrub, which just helps sterilizing the area as well. So in the next 6 weeks, her body will form new collagen here and fill that space with permanent tissue, and give her longer lasting results than, say, a regular filler that would just fill the space and not stimulate new collagen synthesis. So I'm just going to put a little bacitracin on.
It's so numb. So weird.
So I did that whole procedure via 6 little spots. And so now I'm just going to put some bacitracin over those little entry sites, which should heal up really nicely. So there's going to be a little bit of element of swelling as well. This is just bacitracin to help with the entry sites. And that's it, we're done.
All right, thanks for joining us today, guys. Bye.
Bye.